of residents, especially does the department have a retention and development strategy for medical staff for Gauteng, and how do you plan to stop further mass resignation at Helen Joseph Hospital? Thank you very much.
Thank you, Speaker, and I want to thank the member for asking the question. The answer is as follows. Number one, that health professionals, and I think I need to make this point before I answer this question specifically, across the world are a scarce resource. As a result of globalization, we have nurses from South Africa working all over the world, and nurses from the Philippines working all over the world. So, and that's a reality that we face within the WHO. Talks to the health sector about these issues from time to time. The question is, what are we doing to deal with the issues? Specifically to answer the question number one, most of the resignation in April, as you asked, emanated from the proposed amendments to the pension fund that has been misinterpreted in the public sector. And I'm sure if you ask MEC Lusufi, he will also tell you that he had more or less the same challenges in the education sector. Some of the nurses that resigned had nothing to do with the misinterpretation of the amendment to the Pension Act, but it had to do with people wanting to be closer to their families, in particular wanting to go back to KZN, those who were residing in Gauteng, and some of them wanted to go back to Limpopo, again to be closer to their families. Question number two, the appointment of service providers relating to the Helen Joseph nursing residence. We've asked the ID to look at this work. They've already appointed a service provider who's going to service provider to run a rapid generic refurbishment to identify nurses residents that has been approved. So that work is going ahead, and the ID is in the process of drawing detailed plans so that we can have the proper bill of quantities and there's proper specification in relation to this renovation. I also need to indicate that this covers both the doctors and nurses. There's also a high illegal occupancy rate there, and we're intending to start processes not only at Helen Joseph across the province of getting people who've been brought in there, but our health employees to come and live there illegally. So that work is also going to start. With regards to question number three, we did answer your question, Honorable Member, so maybe you may be satisfied about the answer, but the question was answered. Number four, yes, we do have a retention strategy, and it is comprehensive. It is also in line with what National is doing. And remember, whatever the point I was raising early on about the issues of scarce resources amongst the health professional, that not only affects Gauteng, but it affects the world as a whole. So that retention strategy is in keeping with this. That is why government introduced the occupational specific dispensation in 2009 in the health sector, and the refinements continue to be done all along to try and make sure, along the way, to try and ensure that indeed we retain the scarce skill in the country and in the province. Answer number five, there is no evidence of mass resignation. The Helen Joseph issue was just a few nurses who resigned for this pension things, but the other nurses, as I said, they resigned because they wanted to get closer to work and to be closer to their families in other provinces. Thank you very much.
Supplementary question from Honorable Khaiyane.
Thank you, Madam Speaker. Now, I just want to ask the MEC, when did you appoint that contract, and when did you realize that there is a problem of analytic in Helen Joseph? When did you realize the problem? And when you are saying there's no mass of resignation of nurses at Helen Joseph, can you prove to us, because we are aware that the reason is not because they are going to Limpopo, as you have indicated, they are going to other places. It's because of the situation at Helen Joseph. Thank you very much.
Honorable Wilson.
Chair, as to when the contractor was appointed, I think MEC Mayatula Khoza's best place. DID looks after all our health facilities in the province, so the best place to answer the details, who's the contractor, when are they appointed, and what kind of work they're doing, and the time frames and all of that. that I should prove that nurses have resigned en masse. Remember, our HR people indicate why they are leaving. So on the basis of that, that's why I'm answering the question. If the member has other reasons that are not stated in terms of our HR and why people are leaving, then that's a different matter altogether. So what I'm stating in the House is on the basis of what the records that we have in the department, and that's the information I have, and there's no any other source that we can have other than our HR and that the employees, when they leave, they indicate the reasons for their leaving.
Let's go to the last questions from the EFF in terms of supplementary. I'm not going to allow more than 2 members from each party to raise issues. Honorable Secretary.
Thank you, Speaker. I just need to check with the MEC. Will you agree with me that some of the contributing factors include overcrowding, lack of resources and equipment, overworking of nurses, but still paying them, what they refer to as peanuts? Do you agree with me that these are some of the factors, actual critical factors, contributing to the mass resignation of nurses in hospitals and in clinics around Gauteng? And in your words, you've indicated that nursing is a scarce skill. And yet, when you respond to the question posed by Honorable Khaiyane, it sounds like you are satisfied that only few of them have resigned. And that classification, Yama nurses as few, yet we acknowledge that they are scarce, is an indication that it seems as if you were not touched nor moved by their resignation, simply because you acknowledge that it's just a few of them. And if it is such a scarce skill, how do you plan on replacing them? So that we can, you see, health should be a priority, Honorable MEC. And your response is raising a lot of questions that satisfying ourselves on whether to take this department or this field very serious. We're talking about the lives of our people here. It doesn't really matter whether it's 2, 3, 4 who have resigned. But the fact that they are resigning shows that there's a problem, and that problem must be attended to.
Honorable MEC.
Thank you very much, Speaker, and I'll answer the question as follows. The fact that I said, the question asked that there's mass resignation of nurses, and I answered that it's not mass resignation, it is few nurses. And therefore, and I want to further say that, as I said before, that nursing is a scarce skill, and that's a given factor. What I will have, I can cry and stand here and cry that we don't have nurses. I'm not going to get them today. What we are doing with MEC Chris, and I think that's what the Premier was saying early in his answer, that we're doing with the support of Treasury, we're making sure, that's why MEC Chris last week announced further resources to the Department of Health and ensuring that we're able to hire more nurses and doctors, those who are in training and all of that. We are, in response to what exactly we are doing, we are producing more than 800 nurses. We're starting at the beginning of January next year. We're currently in training in our colleges who are coming into the system. We're also further engaging with the Nursing Council to look at the types of nurses that have been coming out of the system and the accredited courses and the shortage, the gap that we have in the system. And there's a lot of extensive work that we're doing together with the Nursing Council. So I'm confident that the work that we're doing does not suggest that we're not interested in the issues that the shortage of nurses, but we are doing something about it. As to the conditions, the working conditions and all of that, there is no secret that the public sector, healthcare sector is overloaded. The same clinic that is in Pimville or in Tembisa, which was seeing 10,000 people in 1994, today it is seeing 50,000 people. That is a reality, and we're not going to escape that reality. However, the resources are not available to match the demands of a number of citizens who are sick vis-a-vis what we need to be doing. One of the things that the House should be interested in is what are we doing as members of the legislature and communities to end